Women often encounter problems with their menstrual period, particularly with the changes in color. Normally the color of the discharge is reddish, like that of blood. Yet, there are times when the color is slightly or entirely different from the norm. For example, there may be times when you find your period blood appearing to be brown. Most of the time, this occurrence is perfectly normal, although there are some cases in which it indicates an underlying condition that needs medical attention. The lining of the uterus or the endometrium thickens in preparation for pregnancy. When fertilization and hence pregnancy does not occur, the body of the woman sheds this lining, together with blood during the menstrual period. The amount of fluid in the blood lost during menstruation is commonly between 4 to 12 teaspoons per cycle. The average cycle of menstruation commonly lasts up to 28 days, although some women have different menstrual cycles, some as short as 21 days, while others take as long as 35 days. Normally, the menstrual period lasts from 2 days to several days. Brown period blood is nothing but old blood. When the blood, and the tissue lining the uterus breaks down, and exits the body, it is exposed to the oxygen in the air. So, the blood goes through an oxidation process, turning the period blood brown. Brown period blood is often visible at the start of your cycle, especially when there is a little blood left from your earlier cycle. You may also notice brown blood at the end of the cycle, when the flow is lighter. In these cases, the blood comes out slowly, allowing oxidation to take place and turn brown. Similarly, when the blood moves fast or the flow is heavy, the period blood is dark or bright red. Apart from oxidation, consumption or leafy vegetables, intake of iron supplements and eating red meat can also make your period blood on the browner side. This is due to the fact that iron in the blood accelerates the oxidation process. Another factor for period blood to be brown is birth control pills. They contain low or no estrogen, causing breakthrough bleeding or spotting to occur between menstrual periods. Should one worry about brown period blood? Well, if the brown period blood is associated with your menstrual cycle, like say, few days before or after your period, or even during breakthrough bleeding, it is pretty normal. But if it happens outside your normal menstrual cycle or after sex, may hint at a bacterial infection, yeast infection, sexually transmitted infection, miscarriage or ectopic pregnancy. Brown period blood may also be a sign of PCOS, a hormonal disorder, when the ovaries do not regularly release an egg consistently, causing the cycles to be skipped for prolonged periods of time, leading to irregular discharge and even brown spotting. If you have found this video helpful, please like, share and subscribe to the channel, Health Destination.